This particular joint becomes inflamed due to damage within the joint, damage being caused by one of three causes. Most common cause is bruxism, bruxism meaning clenching and grinding. Also caused by acute trauma to the face and the jaws. Most common issue there is whiplash, which is seen frequently in automobile accidents, and then functional malocclusions where the bite is so bad, the bite is so uneven that it overloads the joint, causing damage within the joint. That is called a functional malocclusion. And the dysfunction is creating damage, and after damage, inflammation of the jaw joint itself. So for those three reasons, we get damage and inflammation in the joint. When the inflammation gets severe enough, what occurs is that inflammatory fluid can penetrate a very, very thin portion of bone, literally paper thin, between the posterior aspect of the glenoid fossa and the anterior aspect of the external artery canal. Deeper, now the bone here is relatively thick, but when you go down this ear canal about 5 millimeters or so, you will see, and I'll try to show you that on actually a actual skull in a moment, that there is a very, very thin, paper thin portion of bone that will allow the inflammatory fluid and inflammatory cell exudate to penetrate that paper-thin piece of bone and get on the inside of the external artery canal. It doesn't necessarily have to cause swelling and redness because it's coming not from the external part of the canal, it's coming from the internal part of the glenoid fossa, which penetrates the bone. As soon as it penetrates the bone, it stimulates the pain receptors, which cover the bone itself on the inside of the ear canal.
Ask your dentist if they are a TMJ services provider.